So good afternoon, everybody. We are absolutely excited to be back for our yet only second week of our telecast, and we're looking forward to talking about some interesting stuff today. For those of you who joined us the last time, all 11 of you, thank you very much. We look forward to hopefully speaking to 12 people this week. We recognize that this may not be the most widely popular set of topics, and it's certainly a set of topics that we feel our patients and women, even outside the practice, will benefit from, and we love talking about it. So we did venture out on this telecast plan that I think we're going to wind up doing for, forever. It's a lot of fun. We're having a great time with it. We're really enjoying exploring some of the topics, and we're really excited about getting some amazing questions, which we've been getting from our patients, and that's where we are. We're just an excited group of people, and we're all dealing with the same sort of change in the world of working and living that everybody else is, and that's a lot of fun for us. It's interesting. That's a change in life and a change in direction of the way we're working. So if for those of you who don't recognize her, we have Dr. Janette Davison, who
Hi
is
everyone.
here on the right side of your, hopefully on the right side of your screen, and she's at home, and I'm at home too. If you potentially couldn't tell, Dr. Davison has been working in our practice for what is it now? Like 6 minutes, 7 minutes?
Uh, 6 minutes, aka 6 years.
6 years.
Six
Oh,
years.
I lost that. Yes. And
Feels like
she's
6 minutes.
Yeah, exactly.
So
Um,
fresh.
Dr. Davison has very quickly become one of the foremost experts in chronic pelvic pain on the East Coast, and gets referrals from all over the world. She's a board certified obstetrician gynecologist, and is really thus an expert in all things women's health care, and certainly everything related to gynecology. As for myself, um, I'm just a simple country doc, try to keep my business open, and my my family safe and happy. I also take care of women with chronic pelvic pain, and really enjoy what I do, and really enjoy running the business. And now I have to, pardon me. I hope that's not coronavirus. It's probably my it's probably my lunch. So bear with me for a second. Um, so yeah, I've transitioned my world into sort of working from home, and having a different sort of change in venue most of the week. I'm like many of you, at home, working as best I can, trying to do the best I can by the family, and like many of you, sometimes we have to go into the office, which is what I do, but. What you should know about our practice is that our doctors are in the offices, and our doctors are out there taking care of people. And I think one of our biggest fears, and one of my biggest fears, and I think that's echoed throughout the community of people who are experts in public health, is that coronavirus is not the only problem out there. COVID-19 is not the only diagnosable disease that exists in the world. People die of all sorts of other things. People get diagnosed with all sorts of other things that are picked up at routine visits. And telling people they can't or shouldn't come to the office just because there may be some slightly elevated risk. Well, there may be the bigger risk, maybe not coming to the office to get your annual exam, annual follow up. And we want to make sure that patients know that we've kept our office as safe as it could possibly be, and we really want to make sure that we're able to offer you the best care possible. So Dr. Davison,
Yes.
what's happening in Casa de Davison? What's going on over there? Are the kids good? What's doing?
Kids are good. Um, Thriving in computer school
Good,
some days.
good. Now they're
Some
very
days.
young, your children. Is that correct?
My kids are 2.5 and 4.5.
Boy, monster stage.
So they're little monsters. There's punctuated moments of quiet with computer school, and then no, they're great. They're like each other's best friends, and they're having a good time, and we're trying to keep it light. So we're good. We're both working from home, like many of you are, which is interesting. Um, and next week I'll be back in the office full time, which I'm looking forward to say the least, after that intro.
Hold it. So in no uncertain terms, we all love what we do. We also all love our families, but too much of one or too much of the other is no good.
It's not good. And, sometimes I've had those days at work where, it was a stressful day and you wonder, like, what am I missing at home? And is this the right thing? Well, this has helped me reassure myself that it's the right thing for me to be working, because being home is has its challenges. No, it's great, but I think there's definitely a balance you realize that you have, and that balance has been lost a little bit now. So I'm looking forward to going back.
So you miss some of the things when you go to work, which are the things that you don't want, which are the kids fighting or the screaming or not listening.
Well,
Um,
conversation.
yeah. So I felt bad. I felt bad at one point, many years ago, when I left my dog in my apartment and he was barking like crazy, and I felt bad, one, because the dog was unhappy, but two, because I didn't want to annoy the neighbors. And the best thing one buddy of mine said to me as we were leaving the apartment was, let's just go, let's leave. You're not gonna hear it, so it's not gonna bother you.
Yeah,
So
yeah,
I
yeah,
felt good a couple minutes later. So yeah, the kids are still fighting and they're still misbehaving, but we're at work, so we're
yeah.
not gonna hear it. So just before we get into the meat of the topic today and have some interesting stuff to talk about, I just want to share some stuff with you guys. We're just like everybody else, very steeped, just like all other healthcare providers and healthcare organizations, very steeped into the business of managing our businesses in association with how we deal with COVID-19 and all the closures around it. And we really want to make sure that hang on one second. We really want to make sure that people um, are able to enjoy the world around them while still managing their lives in association with risk that they may have with COVID-19. So, again, our practice is very active and very enthusiastic about making sure we do all that for you guys. So to that end, we've sent out a couple of announcements. We're looking to reopen our offices. We certainly want to comply with timelines and stay-at-home orders and proper precautions. And we've eliminated things at the front desk like our iPads, which are fomites. And by the way, fomites is just a big fancy word for something that transmits disease from one person to the other and is inanimate. So another example of a fomite would be our iPads. Our iPads are fomites. Someone has coronavirus, the next thing you know, our receptionist has it. So we've eliminated that. We've moved over to online check-in and online co-pays. We're taking people's temperatures. We're enforcing the mask wearing. We're enforcing traffic rules. We're putting people right in rooms. We're doing all the things that we can to make it safe to come to our offices. So we're really excited about getting reopened in the next week or two, as we realize that those screening visits, those annual exams, those visits for things you may think now are minor, may later then become big issues. And we certainly want to make sure we can do our best to take care of them for you. Another piece of good news that has absolutely nothing to do with women's health, but if we shut down, then we realize 65,000 women who are our active patients will be without a group of doctors who can easily take care of them. The sounds like the SBA has now had approval for refunding the Paycheck Protection Program, which allows us to continue to operate. Without it, we're not sure we'd be able to. So we're very happy about that. So that's good stuff. We wish it had happened a week earlier, but I I absolutely promise you I will not talk about any politics or my political views on this. That makes Dr. Davison happy. I will not talk about politics or any of my.
You've heard it here. There was a promise made.
Right, exactly. Or any of my political views. I will keep it to the practice. I will keep it to talking about how wonderful our doctors are, and I will keep it to talking about women's health issues in general. So, all right. So this topic has been on my mind for a pretty long time. Many years ago, I thought when this is how old I am, even though hopefully I don't look it, but many years ago, I realized that the internet was a how would you say a pit, a swamp of misinformation. That essentially you could put any piece of information you want. This was literally back in like 1998. And we looked at some items on the internet that were general health items, and realized that 70 something percent of them were wrong. We're just flat out wrong. It's not consistent with national guidelines or recommendations, or they weren't consistent with the way good medical practice was being conducted at the time. So I haven't thought about it that much over the years. I've been busy with other things, but now that I'm exclusively really doing nothing but taking care of women, it's then occurred to me again that there's so much out there that we can talk about in association with what's good and what's potentially bad on the internet in the area of marketing to women. And by the way, in case you didn't realize, women make up 50% of the population. So if you can actually, isn't it 50.6? Don't women dominate the human race? Don't women dominate the human population?
If they don't, they should.
Exactly. It was funny because I saw, forget, no politics. Hold it, no politics about the fact that the countries with women leaders are doing. Did you see that?
Incredible things, like including, I forget which country it was, if it was Iceland or I can't remember now. Like incredible events, like the leaders hosting a session just for children, no adults around, no adults allowed, to answer questions about COVID and address their concerns. Like just incredible sort of unique leadership in these countries. Yeah. But anyway, some of these countries report 4 to 6 deaths total from COVID. It's like pretty incredible.
Yeah, it's pretty incredible, and those are countries with female leaders.
Yeah.
Exclusively. So very interesting to me.
The link is in Forbes, I think, if you're looking for it.
Maybe I can put that up on the screen. I could potentially do that if you would like me to. I could put that up from our studio and kind of go from there. Let's see. We can put this up in the studio. If I had the link, which I do.
I can send it to you.
Forbes. This is the last time we'll get into any politics, right? Forbes women's health leaders, women's leaders.
I think I have it in here somewhere. I can send it to you.
That would be cool to put it up on the screen. Anyway, so why don't we talk about some of the things that we understand and that are near and dear to our hearts with regard to what's out there on the internet for products that are marketed to women. So let's just jump right into it. So
I sent you the link in case you're looking for it.
So let's say, just from a numbers standpoint, 50% of the population is female. In America, that would be about 115 million people. And among those 115 million people, how many do we think are premenopausal and post menarche? And menarche is when you start. The word menarche is a term used for the first time you have a period. So happens anywhere between 10 and 12 or 13 for most women. So what percentage of that, Janette, do we think are premenopausal or actively menstruating women? 70%? 60%?
Yeah, maybe a little less. Yeah, maybe 60%.
So let's say there's 62 million women who are actively menstruating in the country. That means whoever's marketing products to women menstrual products to women are marketing to 62 million people, which is a pretty good market to start off with. So what's out there? So what are the most common? So I'm going to let you take over here because you have a little bit more experience with menstrual products than I do. Um, so what's out there for menstrual products? What are the options? What are the options without getting
Um,
bombarded with crazy marketing?
yeah, so you're just your standard tampons or pads essentially. You know, now there are a lot more options um, that are not even so new anymore, but a lot of patients are using some sort of menstrual cup, like a Diva Cup was the original one. Um, in terms of the just standard tampons, they've been uh, sort of marketed in all different ways. But now there's a lot more branding and talk about recycled or reusable sort of materials, organic materials.
So let's talk about that.
Um,
What are these organic materials, and are they useful? I mean, are we talking about plain organic cotton, Egyptian threads, like a thread count, like you have on your sheet? What are we talking about here? Organic materials. And so I presume like
um,
old tampons are like spun polypropylene. Is that mainly the?
yeah, and I think that the idea here is just like a single material, like organic cotton, and no, sort of being assured that there's nothing added to the product. So there's that brand, and we're not being uh, compensated by any of these brands. There's full
Oh,
disclosure here.
hold on. I forgot to give the disclaimer. So the disclaimer
Yeah.
was we're not promoting any product here. We can care less if you buy one or the other. We just want everyone to be safe and happy, and we want you to be healthy, and we want you to not come in complaining that X, Y, or Z product is causing you problems. That's what we want. So no. So the disclosure that I meant to give much earlier was we're not being paid to promote any one product. We might mention a few brand names, but this is just us talking as doctors.
So in any case, there's a brand called Lola, which you may have heard of, which is I'm sure there are other brands, but marketed as this organic brand, and it's even carried in some fitness studios
Oh,
with sort of in
really?
partnerships. Yeah,
Interesting.
um, like some of the spinning studios, I think. Um, in any case, I think that the most important thing that I tell patients is not necessarily whether it's organic or not. I think there is an effect that we see in terms of using scented products, scented dyed products. That's generally a no-no in terms of when we review vulvar hygiene and risks for recurrent vaginitis. That refers to bacterial infections like bacterial vaginosis or yeast. I definitely see in my experience that some of these scented products are not ideal. So I don't generally recommend that these products have to be organic that they use, but I do tend to tell people to avoid any scented products. I don't know
So
how
why
you
would so
feel about
I
that.
I get the marketing piece to the organic. I get that there's some level of marketing shtick associated with use of the word organic. We're glad they're not using the word farm to table to describe tampons or pads because that would be really weird. We want to understand though when you get organic, does that mean it has the same type of organic standards as, for example, you would get in sheets? What does the FDA have to say about this? I guess those are topics we didn't really explore from preparation here. It would be really interesting. Maybe we'll pick that up at another week to find out what the government has to say about some of these products and whether or not the FDA steps in when something is suboptimal. I mean, think about it. If you've got 62 million, let's say all 62 million women buy a particular product that the FDA has not said a word about, or that has something in it, and even 1% of those women, um, and even 1% of those women don't or have an adverse reaction to it, then there's going to potentially be a lot of women who have vaginitis. So one of the important takeaways from this is that it's critical to be able to use a product that has been time tested, hopefully FDA approved, and to Dr. Davison's point, has actually as few additives as possible. So organic, scent free, dye free. It's unclear to me why anyone would want a scented tampon in the first place. Typically, in our experience, adverse or unpleasant vaginal odors are associated with bacterial infection. And that's something that can be treated much better by your physician than with a scented tampon.
I will say though, sort of on the same note, yeah, I think patients are thinking that a lot of these things that are marketed to them are actually helpful when in fact they may not be. Like, I think that using scented products, they think as a way of being clean, avoiding any odors. But in fact, we actually see, and another example I'll give you in a second, but we actually see an association with new odors that are not good, and discharge that's abnormal, and vaginitis with scented products, even though you think you're doing good by using these. And so similarly, patients come to us a lot using various products, which maybe we should include next time, like these pH balance products and soaps and Vagisil and wipes. And all of these things, even though they even might be marketed as, to stabilize pH, they actually more often than not do the opposite.
Yeek, yeah, absolutely.
So avoid all those things despite the marketing.
Right, we should definitely do another week on, or another weekly talk on avoiding some of those other products as well. So you mentioned the Diva Cup. I have a lot of patients who use the Diva Cup. They swear by it. There's another similar product on the market called there's a soft cup. It's called Soft Cup. It's a menstrual disc, which also I believe focuses in on capturing blood, so it doesn't come out, and then you can take it out at your convenience. So what are your patients experiencing with the Diva Cup? Seems to be very popular, and I have yet to see any harm associated with it.
Yeah. So I think the idea here, and we could talk about that whole tampon tax and thing that
Politics,
taxing on these. Yeah, I know. I can't. We won't talk about it now. But
part of the idea
the
politics of government, of institutional discrimination against women. That's a whole other week.
Yeah. Okay. Well, we'll save that. There's so much material here.
Yeah.
So I think the idea, in honor of Earth Day, this week, partially these products allow you to create less waste, right? And then also just in terms of expense, you have something that can just be reused, washed. So you're not going out every month spending whatever the dollar amount is on these products, which can be quite expensive. So patients really like these.
So Diva Cup can be reused.
Right.
So it's not something you buy and you toss.
No.
That's great. I love that. That's awesome.
It's so great. It's such a smart idea, and it comes in different sizes. I will say that most patients really like it. I think the two elements that are sometimes tricky are the fit. So I think some patients sometimes have leakage if they have, sort of not the right fit, or if they have maybe too heavy a flow, although there are different sizes. But the other thing I will note, and I've been saying this for, over a year at least, I've been meaning to look into this more if there are any papers on it, but I've had quite a few patients who have IUDs, who use a Diva Cup, and probably more often than not, they have copper IUDs. Copper IUDs compared to hormone IUDs, copper IUDs are associated with continued normal periods, sometimes slightly heavier than baseline, where progesterone IUDs, so that's your common Mirena, Liletta, oftentimes are associated with very little bleeding or no bleeding. So those patients might not be using Diva Cups because they don't really have flow. But in any case, I've seen quite a few patients dislodge their IUDs. They have been using Diva Cups and they come in with some vague symptom, increased cramping, increased bleeding, abnormal bleeding, and I do an ultrasound, their IUD is low lying. A few of them have even just pulled out the IUD. So I don't know that there's any like product labeling. And so the first couple of these,
happens?
I mean, I think because there's a component of suction, right? So when they pull it out, we try to leave the strings 2 to 3 centimeters so they don't become, too sharp for a partner, and so that we can also retrieve it later. So they sort of sweep to the side of the cervix. But I think in some patients that suction, just yanks it out. So that's my warning. I've seen it enough times now where I've actually sort of discouraged people from using them if they have an IUD, but I don't know that there's any sort of
Interesting.
studies.
So to be no, there isn't. But to be clear, putting an IUD in is not a small thing for a lot of women. It can be a very uncomfortable procedure, even potentially painful. We even have an experience with having to do some under anesthesia in the office. So it's
Hmm.
not a small thing. So and an expensive thing for the insurance company, but that's not really our concern in this regard. So the IUD comes out, then potentially you have to put it back in, but it's not so bad. The worst part is that they may not have, because the IUD is small, right? It's a couple centimeters.
Right.
So they may not actually, with all the blood there, they may not actually have recognized that the IUD came out, and then they're having unprotected intercourse, getting right
Yeah.
towards mid-cycle when they're
Right.
potentially most fertile, and
Or it's low lying.
having an unintended pregnancy. Either one is no good. All right, let's move on
Right.
to some other cool stuff. Hey, anyone out there who's listening, thank you for coming to join us. We really appreciate it. We're really excited to have these conversations with everybody out there. And certainly, if you have any questions, type them into the live chat, and we'll answer them. We're very happy to do that, even if it's slightly off topic. We'll certainly join you for another for some of those answers. So, Dr. Davison, you brought up something earlier, which was very interesting in the talk before we went on when we went live. You were talking about menstrual underwear. So, just a little, very brief conversation about menstrual underwear, and we'll go on to some other stuff after it.
Yeah, so there's this new product that I've had several patients give feedback on. It's marketed as Thinks, and there may be other
She
ones, but
thinks, right? So I'm gonna put that
She
link
Thinks,
up.
yeah.
She thinks I'm gonna put that link
She
up.
Thinks. So, it's come up mainly for patients in general, but those who I've placed progesterone IUDs where they have this, we tell them 3 to 6 months of potentially abnormal bleeding. Anything goes, could be daily spotting, 2 periods in a month. And so for most patients, as long as you set that expectation, like with all things, they deal with it and they're fine. And then, the remaining life of the IUD, they have lighter or no periods. But those first couple of months can be quite annoying. And, sometimes when patients are needing to wear panty liners daily, they can develop secondary vaginitis. And so to avoid that, I've had several patients using these Thinks underwear. The website is shethinks.com. And they come in different sizes. And essentially, it obviates the need to wear a pad or a tampon, which the bleeding is too light for, and you can just wash the underwear. So people like those a lot, actually. So I've been starting to
Very,
recommend them as
very
well.
interesting. So we've got the link up there to shethinks.com. We won't leave it up there too long. We'll kind of move on to our next subject. Um, let's see. How do we get rid of that? Just like that. Goodbye. Um, all right. So we wanted to talk about some of the things that are frequently marketed with regard to, and there's some confusion in this area. I acknowledge the marketing is very confusing. I want to talk about probiotics. And the reason I want to talk about probiotics is because I think there's a lot of confusion around probiotics associated with I'm going to air quote, I'm sorry. I had to do it. I do apologize. Um, about probiotics with regard to gut health, and then probiotics with regard to vaginal health. And I think that's sort of the big area of confusion. Robin, thank you very much for your comments, and same to you, Penny. Certainly, we will publish this on our YouTube channel, as well as I think we'll put it on our Facebook page as well. We'll be back every week doing these, so we look forward to you joining us again. So let's talk about probiotics. So there are a lot of probiotics products out there. The first question then becomes, are so-called probiotics even necessary? So I'm not going to even answer that question in a very clear way, and I'll tell you why. Because the probiotics that are marketed towards gut health, it's really not my area. There are a number of different conditions. There's some well done randomized controlled trials out there in the medical literature that suggest that certain combinations of probiotics for gut health are very helpful for various conditions. Not my area of expertise. But I'll tell you what is my area of expertise is vaginal health. And I very clearly understand that. And what's going on is that we see consistent across the board, almost 100% of the time, that it's recommended to women to use probiotics because they may have had an association with recurrent or persistent bacterial vaginal infections or yeast-associated vaginal infections. And someone said, well, go ahead and use probiotics. Okay, great. So what do I buy? How do I take it? And I think those are two critical questions, because what's happening is they're buying products that are gut health products, and or vaginal health products, so-called. I'm sorry, I hate. Sometimes you just have to air. Sometimes you just have to air quote. So I'm air quoting this. Air quote away. So there are products that are marketed as vaginal health products, but those products are not being given to women in a proper way. And I think there's probably some FDA restriction, because all probiotics are marketed as, or have to be sold as dietary supplements, because they're not medication. They're, you see those commercials, they're not designed to treat, diagnose, or cure any disease, and they're not. But under a physician's supervision, taking probiotics can really offer you some benefits. So let's get right into it. Using probiotics designed to improve vaginal health and taking them orally, swallowing them, does absolutely nothing. All you're doing is swallowing the money you spent on those probiotics, and it's gone. It's doing nothing for your vagina. And that's been our experience, and our patients tell us, well, I started taking probiotics. Nah, it's not helping. Well, how are you taking those probiotics, and which probiotics are you taking? So we have, maybe we should put this on our website as well, conversation about how to take probiotics and which probiotics to take. I think that would be a great idea. And maybe we could do a short, like 3-minute video about it and put it up there as well. But so probiotics that don't contain significant amount of the various species of lactobacilli, and there's no lay word for that, lactobacilli, that comes in a number of different subspecies. So Penny said, yeah, I bought probiotics. It is expensive. And Penny, hopefully I can help you out and tell you, sort of at least get you going in the right direction on how to use them properly. So yeah, they're the vaginal health probiotics. Make sure they have lactobacilli. And if they only have 1 or 2 or 3 lactobacilli species in them, forget it. What you want is at least 10 or 12. Some have 14. The broader the range of lactobacilli species, the more likely it is that that probiotic capsule will contain a couple that are native to your own vagina, and that's what you want. You don't want to change your entire bacterial flora in your vagina. You just want to get back what you need. And yeast infections and vaginal infections kill that natural flora. So then, how do you get it into your vagina? Last I checked, and Dr. Davison can confirm this, there's no connection between your gut, in other words, your from your mouth to your anus. There's no connection there to your vagina. Is it no way for that to get from like mouth to vagina?
Let's hope not.
All right.
Let's hope not.
Otherwise, that's a whole other conversation. That's a whole other conversation, right?
Otherwise, we'll be seeing you for a surgical consultation next.
Right, that's a problem. So this is very simple. I'm going to make this as simple as possible. The easiest way to get this medication into the proper place is to put it in your vagina. Our recommendation in general, if you're going to use probiotics for the specific purpose of improving vaginal health, and I might be putting the cart ahead of the horse here for a second, but I'm going to tell you, is that you have to put them in your vagina. Now, they come in a cellulose capsule. That cellulose doesn't necessarily break down so easily in the vagina. It's designed to break down in the gut, but it doesn't necessarily break down so easily in the vagina. So how do you fix that? What we've been telling patients is to take a safety pin or a little pin and poke 5 or 6 holes right along the capsule, all around it, in multiple areas. It doesn't really matter how many holes you put in it, as long as it's enough to let the stuff out, and it kind of dissolves over time, the cellulose capsule a little bit, and then you get what you need in the place where you need it. So the question then becomes, why would you be taking it in the first place, or why would you be needing to do this in the first place? The first thing to do is to consider that when you have a yeast infection or a vaginal or a bacterial infection in the vagina, it's not always so easy to self-diagnose. Now, some women are very experienced with this. Some women have had repeated infections and they can tell if it's yeast or bacterial and they know. But really, the best thing to do before you buy an over-the-counter product to treat this is to get it diagnosed by your doctor, because the over-the-counter products, which we can also do in a whole other conversation, can cause further problems and also lead to treating something that's not really there. We have a supervised. Janette, have you used this regimen? The supervised, what is it, 45-day regimen of going antibiotics, probiotics, vinegar douches?
Periodically, I know you have that you swear by. I probably use some version of it.
I swear by a lot of things. So
yeah, I more often treat them for whatever, I sort of say, first we have to treat the inciting infection with whatever I decide, which might be a single course of something, or it might be 4 to 6 months of something, depending on what it is, such as Metrogel and diflucan. And then I usually tell them for 2 months after their period to use a vaginal probiotic as sort of a reset, because not even just the yeast and the bacterial vaginosis wiping out the normal bacteria, but the treatments for which is what you're pointing to, the treatments for those vaginitis infections wipe out the normal bacteria as well.
Right.
So I use some combination of what you do.
So some agreement there. I like when there's agreement.
Yeah,
if you ask 7 doctors this question, they'll probably get 8 different answers.
Right.
All right, so let's put out there 3 products that we know of, that two we consider good, 1 not so much. There's one called Florafem. I'm going to put those up in text on the screen. There's one called Florafem. There is another one called GoGirl Probiotics, which we like. And there is another one called Private Party. Now, I'm not going to get into why someone would call it Private Party, but that's what's out there. And that Private Party is the one we, let's see, Florafem. Private Party is the one we don't recommend. And the reason we don't recommend the Private Party one is because of the lack of enough species of lactobacilli, or the lack of enough amount of lactobacilli in each distribution. I think Private Party only has 1 or 2. So here are the good ones: Florafem, GoGirl Probiotics we like. Private Party I would stay away from, and then you could go from there. So I'll leave these up for just a second, and then we can get rid of the text on the screen. I don't know why it says Private Party above my head, but that's a whole different problem. So I was really excited to end with this particular product, and it's something that I came across, and I thought it was so cool. And Dr. Davison was like blown away by it. And hold on one second. And then she brought up a Larry David episode, which I think you can could tie everything in New York back to either Larry David or Seinfeld. And maybe that's a good thing, because these days those were the good old days, right? All right. So we came across a product called GoGirl. And this has nothing to do with menstruation or vaginal health. This has everything to do with urination, which again, we could spend a whole time talking about female urinary dysfunction. But this is not female urinary dysfunction. This is all about female urinary function. So Dr. Davison, maybe you want to tell us why somebody might want to use GoGirl. I think it's so cool.
It is pretty cool. I in researching this, we came across this in researching this topic of different products out there. So essentially, I guess they market it as there's different reasons. One, it could be, a restroom is inaccessible, or but another thing is some people might be recovering from an injury where it might be uncomfortable to sit down. I mean, that might be a little bit of a stretch, but so you're actually able to stand with this device, sort of how a man would stand at a urinal. So it's that dream we've all been waiting for. So either, a restroom's not accessible, or you don't want to sit on the seat. But caveat is you do not get infections from toilet seats. So I just want to put that out there. We're not promoting that myth.
Right,
While this product is very cool, you should not be afraid about sitting on toilet seats. That's not where you get STDs, and so that's still a myth. But in any case, so it's a device basically to avoid sitting, and you basically apply it sort of with a seal against yourself, and it allows for like a neat stream without a dribble or a mess, and you could stand up.
Dr. Davison is so much more conservative than I am. Who hasn't come across? I don't even want to sit on a porta potty. I don't want to sit on an airplane seat. She's totally right about not getting the yucky kind of infections in general from toilet seats. But I don't even want to sit on those seats. I'm a guy. My hygiene, like versus a woman's hygiene, is not even existent. But but I thought this product was so cool, so that you could just avoid having the displeasure of sitting on a public restroom seat in the places where public restrooms generally aren't that pleasant, such as sporting events, stadiums, porta potties at concerts, or if you're hanging out at I don't know, festival or something like that, then those would be the kind of places where you'd sort of run across a porta potty where you might have to use. So, and unfortunately, they're not always perfectly clean, and I think that using this product is super nice. And so we've kind of extended our time today. We want to. Do you have anything else to add, Dr. Davison?
I don't think so. I think I'd love to hear if anyone has any experience that we haven't just described with any of these products.
I just saw a comment. Someone said GoGirl is very tricky to use. It takes a lot of practice. If you don't have it positioned correctly, it can get very messy. So that's great feedback. That's fantastic.
Yeah, that kind of thing is so helpful. That's what I would think looking at the product, but
the person who posted
not having
that
tried some of these.
Said there are other products out there that work better, and we would love to be able to put those up on our next live telecast to let people know what people came across that does work better than the GoGirl. I can't imagine, now that person's brought this up, I can't imagine that it's one size fits all, right?
Right.
And maybe there are different size devices. I bet there are different sizes, different shapes, because there's no such thing as a one size fits all here. It's impossible. Okay, fantastic. We had a couple of other topics. We'll leave those for now. We can pick those up another time. Next week, we have Dr. Andrew Goldstein coming to join us, who is really, really one of the world's premier experts in your vulva. Shouldn't say it like that. Outside your vulva. He's really one of the
sexual health.
Premier experts in vulvar disease, vulvar disorders, sexual health associated with vulvar disorders. And we're really excited to have him here joining us next week. And I know that he's going to contribute a lot. And I know that he's going to offer us a tremendous amount of benefit from a knowledge standpoint and offer our patients. We will send out next week the same set of announcements. I know a lot of people got a last minute announcement. We'll do that a little bit earlier next week. Catch us on Facebook, catch us on YouTube. Please subscribe to our channel. We'd love to see you back, and we'd love to keep you in the loop. And once again, thank you, Dr. Davison, for taking the time to join us again today. And thank you, everyone, for your comments. They're incredibly helpful. The feedback's incredibly helpful. And we look forward to seeing you next week. Have a great day.